Fab. Okay then, hello everybody and welcome to the UK Healthcare Tableau user group on this Wednesday afternoon. I hope it's not too rainy where you are. It's a bit overcast but dry here. Here's the agenda we've got coming up. Just going to do the welcome and intros, which is where we are now. We've got Andy Kriebel on the call with us. He'll be talking to us about KPIs. And then we have Eli Holder joining us. He'll be talking about bias and stereotyping and how that can lead to less positive outcomes for patients. Then we'll have a bit of a break so you can go get a cuppa. And then Steve will be with us. He'll be talking about templates, how to use templates, specifically with the example of a theograph or a teograph. Then I will be conducting a quiz, holding a quiz based on what the content that we've seen today. So do pay attention to all of our speakers, because there will be prizes up for grabs. We have some Tableau swag that could be up for the prizes. And then we're trialing an after party idea. So after the main bulk of the content of the learning material today, we'll invite you to a Zoom call where you won't be muted, you can be on camera, and we can just have a good old chat about what we've learned today, continue the discussions, or anything that you fancy talking about, just as a chance to network and continue the discussion. But who are we? Hi, I'm Charlotte. I work for NHS, Arden and Gem CSU, and I'm a Tableau ambassador. I live in Lincolnshire. I've worked for the NHS for about 15 years now, specialising in data visualisation using my fave tool, Tableau. And then I'll let Steve introduce himself.
Hi everybody, I'm Steve. I'm also a Tableau ambassador, but more importantly, a massive congratulations to you, Charlotte, for being a newly appointed Tableau ambassador this year. Congratulations. Thanks for all your hard work for putting this toe together, because it certainly wouldn't be here without you. So thanks for rising us from the ashes. Really appreciate that. I set up VizDJ some time ago to help orchestrate people around Tableau, to get the most out of it as productively as people possibly can. And so I enjoy working alongside Charlotte to help do that through the format of this Tableau user group.
Awesome. Thank you, Steve. I just want to highlight some upcoming tugs that we think that you will love. So later today, in fact, straight after this, you can go straight from ours to the Northeast Tableau user group, which is being held hybridly, so it's being held in person and virtually. And Andy is also speaking on that too. So if you want a little bit of a double Andy, head on to the Northeast Tableau user group. There's also the Tablet public user group coming up, Tableau Buddy Talks, Analytics Tableau user group, Newbies Tableau group, and Data Plus Women London. I would really say the analytics and the Tableau newbies, I always enjoy going to those. I always enjoy learning something new. I'm not a Tableau newbie, but there's always little tricks that I don't know that come in nice and handy. I also just want to highlight that there are 5 location tugs within the UK that you can also join in addition to this tug. There's one in London, there's one in Nottingham, there's one in Scotland, the Northeast and the Northwest. So please do check those out. And these are all linked, so you'll get the links when you get the slides being sent out. We also just want to highlight that there is a sort of mini conference in about a month's time in London, DataFam Europe. The registration opened a couple of weeks ago. It's going to be a fantastic event on the 11th and 12th of November. 2 whole days of programming, 30 plus sessions in the heart of London in St. Paul's. I'm going, Steve's going. We're going to be planning a healthcare meetup there as well. So if you are coming along, please do look up for that and come and say hello to us, because we would really love to talk to you. Just highlighting next a couple of initiatives, community initiatives that are on the go at the moment. Data Plus TV was launched last month. It's a collaboration between Tableau and IMDb, where IMDb has given us a ton of data, all to do with TV shows for us to work in. So dive into that data set and learn some more about your favourite TV shows. There's also IronViz, which is the world's biggest data visualization competition. The qualifiers are open at the moment until the end of this month. So if you think you've got what it takes, have a go at it. The theme this year is entertainment. So you can pick up the TV data set or the movies data set from last year, or find your own data set on things that you find entertaining, and submit that for IronViz. I think that's the end of my introduction.
Sorry, can I just jump in very, very quickly? Yeah. We were talking earlier on. I knew there was something I'd forgotten. There's another initiative which people might be aware, like to know, which is also called Tableau Buddy Sandbox. So if anybody is moving into or wanting to move into the data analytics space, there's a competition which is going ahead right now, which ends at the end of October, where you can enter and get free training resources, licensing, and also mentoring. To help speed up and enter yourself into the career of Tableau Analytics using Tableau. So I'm just putting that link into the chat as well. So that's cool. Tableau Sandbox.
And one of the mentors is a familiar face to us, right, Steve?
It might be me, yeah. Yeah, it might be one of those mentors. I was humbled and lucky to be chosen.
Yep. So going to move on to our content now. Our first guest speaker today is Andy Kriebel. Andy is the founder and head coach of Next Level Tableau, and over the last 2 decades, he has helped thousands of people develop great careers in data. He started the first 2 Tableau community projects, Makeover Monday and Workout Wednesday, and he co-authored the book Makeover Monday, Improving How We Visualize and Analyze Data One Chart at a Time with Eva Murray. And here it is here. So I'm going to stop sharing and hand over to Andy.
Thank you very much, and thank you for having me, Charlotte and Steve.
Thank
Steve,
you.
it's nice to put a face to the name. I didn't recognize you because you don't have the goatee. So you should now be able to...
I lost that this year.
That's okay. You can go find it. So I thought I'd start out with kind of a definition of what KPIs are. And Charlotte, just interrupt me if there's any questions, because I can't see the chat as well as the slides that I'm showing. I'm just going to quickly run through what KPIs are, and then I'm going to get in and actually build KPIs in Tableau. And then we could send out the workbook later. I'll put it up on my Tableau public profile so that you can download it and use it for your own data. So what are KPIs? KPI stands for Key Performance Indicators. So basically, they need to monitor the key business objectives. They can be visualized to provide insights into trends or performance, but basically the idea is to help you make quick data-driven decisions. They're important because they help you focus attention on what matters the most. And by tracking the progress against those targets, they give you a picture of where adjustments need to be made. Ideally, they are done with real time. Now, real time doesn't necessarily mean live up to the minute, just whatever the most recent data or whatever data you need to make those decisions. It could be where your real time is last month or something like that, but whatever you need to make more informed decisions. Each KPI should be linked directly to some kind of business goal. Don't just have a business goal. You need to know what question that KPI is answering. Make sure that they are actionable. So you want to include some context so that people know what they want to do with it. Keep them simple. Don't overwhelm them with too many metrics on a dashboard. And I'm going to skip some of this because this is all preparing. As far as colors, when you're creating KPIs, I'll show you how I do that. A lot of people use red and green, which could be an issue with color blindness. So I would check with your audience if that's the case. I typically use, a lot of times I use red for underperforming or blue for exceeding a target. When I was at Coca-Cola, they were the other way around because red means Coca-Cola and blue means Pepsi. So of course, blue is bad. And then make sure your KPIs reflect the most recent data. And then ask your stakeholders for feedback so that you know if they're being used, are they helping them answer the questions that they want to answer. And then we're going to get into, so I'm just going to show you a couple of things here. All right, so we're going to build some things. And I know that was a whirlwind tour, but people are here to actually see Tableau being used. So actually, I probably could switch. That's all right. So I'm going to go through, and I have a presentation here as well. I've got a bunch of KPIs we're going to try to build, just different views, basically of the same data. I'm going to start by showing you the calculations that we need, and then we'll start building each of these charts. So I'm going to be flipping back and forth between this presentation and Tableau to make sure I don't miss anything. So let's go ahead and get started. Now, the data set I'm using is pigeon sightings in New York. This is a real data set. People complain, or people call a line called 311. It's basically a complaint line, consumer complaint line, and you can complain about anything. It's a super interesting data set. You can get it on the New York Open Data. I like to use the rat sightings data set, but then I thought, I wonder if they have pigeons, because the pigeons shit everywhere. And most of the time, the pigeon complaints are about unsanitary conditions. So it probably means pigeons pooping all over the place. So what we're going to look at is we're going to try to build that first KPI. So which is, I know this says sales, but this is just the design idea. We're going to look at the most, the year-to-date number of pigeon reportings that there have been. So I'm going to build this out as a table first so that you can see the calculations that I'm going to use. So I'm going to right click and drag created date to the rows. And this data goes down to the minute, but I only want it to go down to the day level. So let's see, I'll just choose month, day, year. Okay, and we have all of our months and days and years. So the data set goes back from 2010 all the way, this is not correct. The data should be through 2024. Sorry, give me 1 second to refresh the extract. So, excellent. All right, so let me close this data set. And sorry, I'm going to connect to the correct one. This is real time. This is how it actually happens in real life, isn't it? Okay, so there we go. And if I now bring this data set out, pigeon sightings, there we go. So we should be able to change the data type to a date. And I had hidden a lot of fields before, but I won't bother with that right now. Okay, so let's see if we're better off now. Sorry about that. So if I now look at month, day, year, and hit OK, it should go through 2024. There we go. So we have everything through the 6th, which was what, last Sunday, something like that. And what we're going to want to compare is the data from 2024 year to date to the data from 2023 year to date. So the first thing I need to do is I need to know, well, what is the most recent date in the data set? So I'm going to create a new calculated field, and I'm going to call it, let me close this window. I'm going to call it most recent date. And I'm going to use a level of detail expression here. So I'm going to start with a mustachio, and I'm going to just do a max of the date trunk, because I want to truncate to the day level of the created date field, right? And then close it off with a mustachio. So what I should get here is an error, which I did. There we go. And click on OK. And now if I drag that to the view, and I'll choose month, day, year here as well, you'll see that I get October 6th returned everywhere. Okay, so that's going to be my most recent date. So I'm going to create another calculated field that is most recent date prior year. And for that, I'm going to use the date add function. So I'm going to add a year, but I'm going to subtract 1 year from my most recent, that's that, most recent date calculation. Okay, and now when I put this in the view and choose month, day, year, I get the same date from the prior year. So these are going to kind of act as my what am I trying to say, Charlotte? My dates I'm going to use for my anchors for my year to date for both this year and last year. Okay, so the number of, I'm just going to create a new calculated field. Let's call this sightings. And I'm just going to put the number 1 in there because each record in this data set is 1 record. So this will just make it a bit easier for me. And there we go. So we have the number of sightings per day. And I want to create a new calculated field that is my sightings year to date. Okay. And what I want to say here is I want to say if my if I am in the most recent year, so if the year of created date is equal to, and I want to get my most recent year, so again, I'm going to use an LOD. Geez, I'm having trouble typing today. Year of created date. And my created date is less than or equal to my most recent created date. Oops, don't want to do that because that will mess it up. So let me just make these consistent. So I'll do date trunc at the day level of my created date. So this is basically just going to bring back the month, day, and year. And is that less than or equal to my most recent date? Okay. And if that's the case, then I want to return a 1 and then end. Okay, so if I bring that into the view now, what you'll see here is as I go through 2024, so let me get rid of these dates because that's probably just going to confuse people. If I go through 2024, which is, let me put that as the second metric, you can see I get dates, I get the number of pigeon sightings back to 2024, and then I get nothing before that. So I'm going to do something similar for the prior year. So I'm just going to duplicate this calculation, and I'll call this sightings prior year to date. Okay, and this time I want to use my max year, but I want to subtract 1 because it's 1 year prior. And here I'm going to use, instead of using this field, I want to say, instead of this one, I want to use my, what field is it? My most recent date prior year. Oops. Oh. Just paste that here. Okay, and if I put that into the view, if I scroll up to 2023, there we go. You can see that in after October 6th, I don't get any dates because those are after my latest date in the prior year. Right? So if I scroll through, you can see I get all of those in 2023. Fabulous. Now, what I'm going to need to do is at some point, I'm going to need to create totals. But so I'm going to leave this table here so that we can come back and look at the totals later. Another metric I want to calculate is my percent difference. So let's call it year to date versus prior year to date. And for this, I'm just going to drag the calculations into the window. And this is one of the reasons I like to build it as a table first, because I can now just drag those calculations in. So if I hit OK, and I bring that into the view, I see day by day. If I go down here, okay, so you see I don't see anything yet, right? So we're going to fix that in a minute. And then if I duplicate this calculation, I now want to do the percent difference, right? So let's do that as a percent. And this is not correct. So let me undo and pretend I didn't do the year to date because I messed it up. And we will come back to that in a minute. Okay, sorry about that. I was getting a step ahead of myself. So this is the first one we want to build, right? So we want to know, well, in the current year, what's the number of pigeon sightings? So I'm just going to drag sightings to the text shelf, and we get 1,112. And then we need to calculate this difference versus the prior year. So what I'm going to do is the first thing I need to do is I need to get sightings total prior year, or no, sorry, year to date. And for this, I'm going to use an LOD because what I want to do is I want to add together all of the sightings to return one number. When I do that, and let me just, if I just put that number here, you'll see nothing changes in this view. If I go back to my table, remember that number was what, 1,112. And if I put my total into the view, notice I get 1,112, right? Regardless of the date, I'm always getting the same value back. I'm getting one value. So let me duplicate that. And I'm going to edit, and I'll call this, let's see, total sightings, prior year to date. And all I need to do here is replace this calculation like that. And then click on OK, put that in the view. And now we can see the difference between the two. Okay, or we can see the two values, current year minus prior year. Now I can create my year-to-date versus prior year to date. And again, for this, I'm going to just drag in these calculations. Okay, and do that. If I drag that into the view now, we can see the difference is 233 for the entire year of 2024, or sorry, for year-to-date 2024 minus year-to-date 2023. Okay, and then I'm going to go ahead and create the percent difference. So year-to-date versus prior year-to-date percent. And for that, it's going to be my year-to-date versus prior year divided by the sum of the prior year. So that's going to give me the year-over-year change. And I know I'm going fast, but I've got a lot to get through. So, and I'm going to immediately set the default number format for that. So I'm going to send it to a custom, and I'm going to do plus 0%, and then a semicolon minus 0%. So that's going to just add a character in front of the plus or the minus. Okay, so if I drag that there, we can see it's a 27% increase year over year. All right, so let me real quick. So let me show the filter here. And let's see if, this is looking at, let me add this to context. So if I look at, okay, so Brooklyn is down 14%. Okay, so what I'm going to do is I'm just going to make a note of that so that I can show you what we need to do in the next sheet. Okay, so we've got 1,112. And we want to include in this, if I flip back over to my slide, I've got my percent difference versus prior year to date. Okay, so I'm just going to drag my percent difference to the text shelf as well. And I can go ahead and start formatting this. Let me bring this window over. And what really annoys me is Tableau always puts these backwards. I don't know if that annoys anybody else. I've never seen them show up in the right order. So maybe I'll make this something like, I don't know, 48. Ooh, that's quite big. So let's do maybe 36, and let's make it bold. And then we'll do versus prior year to date. Okay, so we get something like that. Okay. Now, all right, so we get something like that. Let me center align it. Center align. Okay, now the problem is, you see how what I want to do is I want to color code whether or not it's above 0, right? The plus 27%. You might think, okay, well, I could just put maybe I'll put my year-to-date versus prior year on color, but that colors everything. I just want to color that percentage. All right, so how are we going to go about doing that? Well, what we're going to do is we're going to duplicate this percentage calculation. So let me duplicate that, and I'm going to edit that. And I'm going to call this one positive. So what I'm going to say now is I'm going to say if my year-to-date versus prior year, it doesn't matter, I could use percent. If that's bigger than 0, then I want to return this value and then end. Otherwise, I don't want to return anything. Okay. And I'm going to need to wrap that in a ZN function. Actually, I can just say else 0. Okay, like that. All right, so that's one calculation, and then I'm going to duplicate that calculation, and let's edit the copy. And you'll see why I'm doing this in just a minute. So I'm going to call this one negative, and I'm going to do the same thing, except I'm going to change this to less than 0. Now for each of these, if I drag these onto the text shelf, right, I get something like that. I get plus 0% and then 27%, right? So that doesn't look quite right. So what I need to do here is, you see what it says plus 0%. I actually don't want that to show up. If you look at the tooltip, you'll see where it's negative. This is actually a positive change overall for year-to-date versus prior year. But I want my negative to kind of not show up in this case so that I can color code the positive. So what I'm going to do is I'm going to highlight both of these fields down the bottom in the data pane, and I'm going to set my default properties. And this is what I set up before, but I want 0 to not show up. So I'm going to do a semicolon and then a space. So that's going to replace my 0 with a space. Okay, so it's a good way to make it look like like it's not there. Oops. So I don't want to do my tooltip. Click the wrong button. So now if I look at my text shelf, what I can do is I could get rid of this one, and I can put, let's see. So let me do this. I could put these both on the same line. and then I can do versus prior year to date. Okay, so and then what I could do here for the negative, maybe I'll make that one purple, and this one I'll make, maybe like this bright green, make it bold, and make it bold. Okay, so click here, make that bold. All right, so click on OK, and there we go. So now we're able to color code whether it's a positive or negative. Well, let's look back at that borough situation. So if I show my filter and I start filtering, so I choose the Bronx, well, nothing changed. That's because I need the borough to filter before my level of detail expression gets calculated. So what's happening here is, because of Tableau's order of operations, it's first calculating the totals and then it's filtering the borough. Well, it can't really filter the borough because it's just one number. So I need to add my borough to context. And there we go. So you can see it says 85 and then minus 14%. Versus prior year to date. So that's how you can color code both the positive and the negative as different values. And if you like things along the way, please feel free to drop them in the chat so that I can see them. If you like something, make a comment or a thumbs up or whatever you like, so that I can see what you would like to see. All right, so that's that one. And now what we're going to do is, you'll see this is actually one view. It's looking at, it has that same information that is in my my KPI I just built, but it also includes a line chart. So to do that, I'm going to duplicate this sheet. And what I need to do is I'm going to copy this text box. So let's just copy all of that. And I'm going to stick it into the title. That's going to move my screen over here. And if I move that into the title, you'll see it now shows up there. Okay, great. So each of these I can then move to my detail shelf. And now I've got nothing there. So what I want to do now is I want to look at each of the individual months. So I'm going to right click and drag my order date and choose month. And now I can go back to the fields that I use, not the totals, but the regular fields that I use. So sales, so this is going to be my, why is this not going anywhere? My total year to date. That is not the right, I don't want the total, I want this one. Okay, so that is my year to date. And then I could look at my prior year to date. I'm going to do it on a combined axis. And now I'm going to swap the order of these around so that my year to date is in the front. And then let me just go ahead and edit the colors. So I will make my year to date, maybe, let's pick a good color palette here. Let's use, well, can't find it now. We'll use Maggie on the couch. So year to date is black and prior year to date is purple. Something like that. So now we can see the difference between the two. All right, now what we could do, if we only want to see up into the latest month, what I'm going to do is I'm going to go ahead and, just for this exercise, I'm going to add a data source filter. And I'm going to say something like, I think I'm just going to manually do this filter for now. So where's my created date? Just so that the visualizations look a bit better. So I'm going to do a range of dates. And I want to do my end date as September 30th and click on OK. Okay, so everything adjusted. You'll see my total works now, all of that, right? So let me go ahead and fit this to the entire view. And if I flip back over to my card, notice I have just the letters at the bottom. So I'm going to format my dates and choose just the first letter. And then it's nice and clean. It doesn't have any borders or lines or anything like that. So I'm going to do that actually as a workbook format. So here are my grid lines. I'm going to turn these off. And then I'm going to turn my 0 lines off. I'm going to turn off my axis rulers. And I think that's everything I need to turn off. Yep. And then I'll go ahead and hide the header. Let's see. So I'm going to also edit my axis, and I'm going to uncheck the include 0 option. And if I stick this on a dashboard, so let me just make this dashboard like nice and small and square. Let's say 400 by 400. And if I put this sheet into the view, let me get rid of all that. you'll see I get something like that. Now, you might want to adjust the size. So maybe I'll make it like 300, hide the header. There we go, something like that. And October, November, December aren't showing because we don't have data for those months, and I don't want to show it for the prior year either. Okay, so that is a way to do that KPI card. And if you want to include those little indicators on them, I'm going to duplicate my sheet. So you'll see here, this one just has the current year actually. So let me go back to this sheet, and I'm going to get rid of my prior year to date. Let me just pick my color again. Let's see. So I'm going to, I'll just call this one blank. And I'm going to stick this on the color shelf just so I know I can pick a color easier. And Maggie on the couch. And I'll make this one, maybe I'll make this deep purple, something like that. And if I want to show the min or the max, I'm going to choose this min max option. I'll turn on my field labels. And yeah, and there we go. So I don't want to allow overlap. Maybe I'll align them automatically. And there we go. So now we are showing our min and the max over time. Okay, so if I look back here at the card, you can see that same kind of thing. I'll uncheck show header. Okay. All right. And so that is that there. Okay, so oops. So let's look at the next one. So this is the year-to-date versus prior year. So this is, oops, I keep going the wrong direction here. So that is this one here. So we've already done that one. That's good. It saves us a bit of time. Now you can do the same thing, but in this example here, what I did was, let me go ahead and show my header. I only have one axis, but if I want to go ahead, and I used one axis because I knew I wanted the same chart type for both measures. I wanted a line. But if I want the prior year to be a area chart in the background, I need to move it over to my dual axis. I'm going to make sure I synchronize, and then I'm going to put measure names onto color on the all marks card. So let's put that onto color, and that picks up those colors. I want my year to date to be in the front, and I want this chart to be an area chart, okay? And maybe I'll reduce the opacity so it's just nice and light in the background, something like that. And then again, from there, it's a bit of cleanup, so we can get rid of that. Because I'm using an area chart, I'm not going to exclude 0 because an area chart should always start at 0. Okay, so that is that one. Okay, so something similar here. Notice everything's left aligned in my title though. So why don't I just go ahead and duplicate this sheet. You notice once you get one of them built, it becomes pretty quick to build the rest of them. So I'm going to make this one a bar. And then maybe I'll actually increase my opacity again. Maybe I'll make this line a bit thicker so it looks a bit nicer, something like that. And then in my title, I'm just going to go ahead and left align that. Okay, so same idea there. Now again, if I put these on a dashboard, so let me like take that sheet, or actually I'll just duplicate this dashboard. I'll put these all in one nice dashboard for you at the end. But if I put that one here, let me get rid of that. Okay, you'll see it looks nice and neat now. So maybe I want to do the width is like 300 or whatever. Okay. All right. So how are we looking so far, Charlotte? Any talk about financial years?
Yeah. So yeah, Tom wants to know your playing with calendar years.
Yeah.
Is there a way to anchor?
There are lots of great examples on the forums for that. That is going to be my answer because I hate dealing with financial years. So I'm going to avoid the question. Okay. And then again, we could do just bars. So let me go ahead and what I'll do is I'll go maybe to this one, and I'm going to duplicate the sheet. Let me just move it over here to the end so they're in order. And I'm just going to switch this to be bars. All right, oops, switch it to be bars. There we go. And I need to make sure with the axis on this one that it starts at 0. Okay, so I can see you want to make sure our bar chart always starts at 0. And it looks like there's an increase every month. All right, but I don't want to show any labels. So let me untick that. And I've got my labels on the left-hand side. But what I want to do is I want to get rid of my title. So I'll get rid of that. And there we go. So now we have our 6th example. And hopefully I finish in time. I think I will. Okay, so now we want to look at current year versus prior year, but as a bar inside of a bar. All right, so let's go back over to maybe this option, and I'm going to duplicate this sheet. And I'm going to show you 2 ways to do this one. Oops. There we go. So first thing I'm going to do is I'm going to make them both bars. Why do I keep doing that? Okay, I'm going to show my header as well. Okay, but if I click on one of these, notice it's stacked on top of the other one. So what I need to do is on the menu here at the top, I'm going to go down to analysis and then stack marks and turn them off. And now one is inside the other. So I need to duplicate measure names onto the size shelf. And now this is kind of like a fundraising thermometer type of view, right? We can see the difference between from 1 month to the next in the prior year. Okay, so that is that one. The second way you could do that, so I did that with 1 axis. The other way I could do that is with a dual axis. So I'm going to drag my prior year to the right-hand side. And let me move this one to the front. Let me put my measure names on my marks card. And they're actually not overlapped this time because they're on separate axes that I synchronize. There we go, make sure we synchronize. Let's see, so we're going to keep that one in the front, but all I need to do here is just adjust the bar size, okay? But again, what I did was I used I would typically build this if it's the same chart type, like before we had 2 lines, this time we have 2 bars. I would almost always use a single axis, a combined axis view, because that then frees up my secondary axis for maybe a different mark type. Okay. So that's that. All right, so let's just keep going. So let's duplicate this sheet. And this time I'm going to move I'm going to change this mark type to be a Gantt bar. Okay, there we go. And that is the wrong one. So let me go to sightings year to date. No, prior year to date is the one I want. Yeah. So let's make this a Gantt bar. And now I want to move it to the front, actually. So let's move that mark to the front. And we get something like that. I'll probably make this a bit fatter. The reason I would use a Gantt bar is because I can now control the width of that bar. So with a reference line, I can't control the width. So for example, some people like to do these and they like to put the prior year indicator inside the bar nice and little like that, right? So you get a lot more flexibility when you do it this way. Okay, so let me duplicate this sheet. And I'll show you how to do it with a reference line this time. So let's move this to the detail shelf. And what I want to do now is go to my analytics pane. I'm going to drag on a reference line for each cell. So each cell is a bar. And I want to choose my sightings prior year to date. I'm going to increase the color here. Maybe I'll make them the purplish color, untick the recalculate. Then no label. Okay, so that's good to go, right? So now you see how much wider they are now? So you get to control the width when you use a Gantt bar, but you don't with reference lines. Now, if you want to get around that, you could make it look a bit nicer by going to the borders. And I'm going to add my column dividers as really thick and white, and then I'll increase the level, and you can at least make it look like it didn't work. Okay, so normally these would be separated. Okay, so ignore what I just said. Let's see, is it? Maybe it's here. Okay, anyway. But what I want to do then is I actually want to color code these bars based on whether we're above or below the prior year. Now, what I could do is I could use one of these calculations like year to date versus prior year. Everything, okay, so oh, that's the wrong calculation. Yeah, okay. So this calculation year to date versus prior year, this was my total actually. So I'm going to rename that total so I don't get confused, right? And let me rename this one as well because I just got myself confused. Okay, so what I'm going to do is I'm going to create a new calculated field, and I'm just going to call this year to date greater than prior year to date. And for this, I'm going to just take my my sightings. Where's my sighting? Oh, here we go. Sightings year to date. Come on. And I'm going to say, is that greater than my sightings for the prior year? Okay, so this is just going to return yes or no. And the reason I do that is because it comes back as discrete, meaning I can choose individual colors for those. So I'm going to edit my color palette, and if it is true, let me go to Maggie on the couch. If it's true, I want it to be the dark purple. If it's false, I want it to be the light purple. And then the null I don't need to worry about because those aren't going to show up anyway. And now we can see the difference, which bars are above and which bars are below. So you'll see something like that here. Okay. Right. All right. So no questions there. The next one is, this is looking at just the totals. So what I'm going to do now is I'm going to, let's see, I'll duplicate this sheet. You notice once I get one of these titles done, I'll just keep iterating. I'll just keep duplicating because then I don't have to format my title each time. So it makes it a lot quicker to go through. So in this case, I want to look at the total. So I'm going to drag the month off the view and put the sightings, move that to the rows. And there we go. So now I'm already done creating my year-to-date versus prior year. Okay, that's all we need to do for that one. Very, very simple. If I look at the Bronx, there we go. We see it's false and everything is okay. So I probably should change the color of my reference line to maybe I'll make it a bit thicker and make it like dark. There we go, something like that. I probably need to choose better colors than this. But Maggie's not here, so okay. So that would give us this card here, right? So we're looking at year-to-date versus prior year. Okay, that doesn't look too bad. This is another example where you might want to use a Gantt chart for the other, so you can control the width of that reference line. So if I let me just duplicate this dashboard, let me get rid of this sheet, and if I bring on my new one, so that's going to look. Let me get rid of this. There we go. So we get something like that, right? So that looks pretty good. If I want to make the bar like not so fat, you see how it's nice and thin here. I've got a couple things I could do. I could just go to the size shelf and reduce the size. And now if I go here, you see it looks a bit better, but my reference line looks terrible now. So that's why I would probably use a dual axis then with a Gantt bar to make this look a bit better. Okay. And let's see. Okay, so this one is kind of a combination of some of those other ones we've looked at. So the first thing it does is it kind of takes our totals here, right? This metric. So I'm going to duplicate that one. And let me just drag that to the ends. They're nice and together. And all this is doing is it's just left aligning everything, right? So that's all that's doing. So if I flip back, that's what we see there. Maybe in the title, I should add something like, maybe I'll make this a smaller font, like 14. I'll call this Pigeon Sightings. Yep, something like that. And now you'll see it looks kind of similar to that one there. And so the other thing I'm going to do then is I'm going to duplicate one of these sheets. You'll see how a lot of these are very similar, and I'm just kind of repeating what I'm doing each time. Now the difference here is I have these nice little dots at the bottom. Let me change the colors just to make it a bit easier. Sorry, Maggie. I'm going to change the colors on you. So where are my colors? Where did it go? Okay, maybe I'll do this. So I'll use, oh, I went back to the same. So they really wants me to use Maggie on the couch, I think. So let me just do lighter colors, something like that. Okay, that's a bit better. So what I'm doing here is I've got the bars. I've got these are definitely Gantt lines. I can tell because they're a bit, they look a bit different. So I'm actually going to take my sightings prior year and move that to the right. Let me synchronize. And you can also change the mark type by right-clicking on the axis and changing the mark type to a Gantt bar. So you could just do it right there. And now on my all marks card, Tableau put an extra field on color, so I'm going to remove that one. And then on my sightings prior year, I want to get rid of that as well. So now let's make this black, and we get something like that. So I'll make these a little bit thicker so they just extend beyond those bars. Okay, so now I need to somehow get these circles below the bottom. What I'm going to do for that, I actually could probably use, just use this year-to-date versus prior year field I created. So let me drag that to the, actually I'm going to duplicate, let's see, I'm going to create another calculated field. I'm going to call it my, I'll just call it my indicator. And I'm going to say if my year-to-date versus prior year. So if it's greater than, then I want to return nothing. Otherwise, I want to return a dot, and that's option 8 on the Mac, and then end. Okay, so something like that. Again, it's a discrete measure. Let's put that in the columns. Notice it moved my month labels to the top. That's nice. And then I have these little dots at the bottom. So I can color code these. So let me format these. And I'm going to try to pick the same color that I used. Okay, so what I'm going to do is I'm going to use my little color picker. Choose that color. And maybe I'll make them bold, and I'll make them, make them bigger so we can see what they look like, right? So now I've got these little visual indicators that there is a problem somewhere. So I'll go ahead and hide this header. Let's format the view to get rid of our row and column dividers. Okay, let's say none there. And if I flip back over, you can see that looks nice and neat. I'm going to copy the formatting and paste this across. Oh, it's not going to let me do it. Okay. So now if I put these into a dashboard, so let me create a new dashboard. I'm going to end up hiding the title here. So let's create a new sheet, and I'll make it maybe, I don't know, 600 by 300. And I'm going to drag in a horizontal container because I want them next to each other. And now I need to find the sheet I need to put in. So that sheet first, and then that sheet next to it. And then I can get rid of this, delete the container, and then hide my title. And then maybe what I'll do is, so I have the labels on there on the axes, but I just don't show the title. Does anybody else wish you could just right click and hide title? Anybody else wish that? So there we go. So we've got that one. I can hide the title here, but I don't like this up at the top. You'll see I have it in the middle. So I'm going to go back to that sheet, and in my text, I'm going to make it horizontally in the middle, and then make it fit the entire view. Okay, so that should now, didn't move it to the middle. Okay, so let's fit that to the entire view. Okay, so of course Tableau changes the size for me. So let's maybe make this 150, maybe a bit wider than that, maybe 180, give it a bit more room to breathe. And then I'll add a bit of padding around the outside of this. So let's maybe do 20 pixels of inner padding. And that pulls it off the edges. Now, this 3 nulls indicator, again, that means that we don't have October, November, December. We see these dots here, though, so that's actually a bit of a problem for us. So what I'm going to do, because we shouldn't actually have any indicators there, but it's the way that I wrote my calculation. So if I go back to my indicator calculation, I'm saying if it's greater than or equal to prior year. Okay, so I'm going to need to change this. I need to say, so if it is, so if I go back into that calculation, well, let me just edit this one. So I want to say something like if my sightings year to date is greater than or equal to my sightings prior year, then give me that indicator. Okay, so let me hit apply. Okay, and what's happening here is we have nulls. So I'm going to wrap this in a ZN function, which should convert that to a 0. And now I get an error. What is my error here? Okay, so I think I have the ZN in the wrong place. So I think I need to do ZN here. Let me see if this fixes it. Okay, so same error message. All right. Okay, so why don't I try? So let me close that. All right, let me close that and undo. All right, so what I'm going to do is I'm going to duplicate this calculation, and I'm going to say greater than or equal to, and I'll say something like that minus that, and then wrap it in a ZN. Okay, so that one's okay. So now in my indicator, I could use that field instead. So I could use my greater than or equal to, put that there. So that's going to give me a number. Okay, so I didn't do that right either. So let me edit this one. Sorry, you're finding a bit of troubleshooting here along the way. Greater than or equal to, and then this should be in. And I've got an extra parentheses, I think. I'm missing one here. There we go. Okay, so that indicator's gone now, like we want. Area chart is your go-to. I think the area chart looks terrible, but that's your choice. Okay, so that is all of the KPIs. Now, one other one that you might want to use sometimes. So if I duplicate this sheet, I'm going to actually flip this time. And what I'm going to do instead is I'm going to make these a combined axis. And what I'm going to do is I'm going to make them, I'll make them both bars. And then I want to do something, actually, I'm going to make them both circles. All right, so we're going to do like a barbell chart, something like that. And I'm going to take measure names off. I'm going to move that to, come on, you bastard. And I'm going to make this one a line this time. And you'll see it goes like that. But I'm going to move the indicator measure names to path. And then make this a dual axis. And synchronize. And then I can go ahead and hide this header. And there we go. So now we probably don't need our indicator. So you could do like a barbell chart as well, something like that. Now the trick is, it might get tough for people to keep their eyes going down the view. So if you don't like that, you could always flip it around. And that's just another way to do it. So if it looks like the circles get really fat, just adjust the size of them. And there you go. Something really neat like that. And then another one you could do is if you just get rid of the circles, then you can make the lines a bit thicker and it looks like a rounded bar chart. So you can do something like that. So that looks nice and neat. If you want to do one more, you could make this fat again, like I did, right? Something like that. And then let's put these in the, that's in the front. But on these marks, I want to get rid of, what I want to do here is I want to have measure names on color instead. And, but my colors are, my colors are blending in. So what I need to do here is I would need to adjust my colors. So, okay, well, that didn't work. There's actually two dots here, but you can't see them. But it's kind of, or actually what I could do is I could just put a border on them like that. And now you can see the difference between the two, maybe adjust the size of the circles a bit, and you get something like that. Okay. Whew. What questions do we have?
Thank you, Andy. Has anyone got any questions for Andy? He can't join us for the after party. So if you've got questions, please jump in now with them. Which one's your favorite, Andy?
Which one is my favorite? Let's see. I kind of like, I like the bar and the line, but I like it when the one with the reference line. Where's that one? I like kind of this one. This one doesn't look great because of, actually, why don't I just flip through that's the wrong one. Like this one is one of my favorites because I like it how it has the indicator as well, just kind of like double encoding it. Mm-hmm. I would say this one's probably my favorite.
Cool. Any questions for Andy? Anybody? Just have
I've got one thing more. So so in the comments, if you could please type in there what you like best. That is not optional. Please type in there what you like best. It could be something you learned. It could be one of the charts you like. Something. Type that in the chat. And I just want to show one little thing that I learned last week that we learned in Next Level Tableau is, you know how like most people search for fields? If you click on this little filter by thing, did you know you can filter like this? Did anybody know that?
Cool.
I don't know if that's new or not, but if I want to look at just my calculations, then it just filters down to all my calculations. I think that's like super cool. Anyway.
Dan likes your Gantt charts. Jeff likes number 3.
Yeah.
he said.
Okay, number 3 with trend line was good. Just watch work through Tableau. Okay, so nobody else is going to answer me, Charlotte. Okay, with that being said, I would like to extend to everybody on this tug that if you want to join Next Level Tableau, I will honor a 50% off coupon that I was actually only going to give to the Northeast Tableau user group folks. But I thought if Charlotte finds that out, I'm going to be in trouble. So if you want to join Next Level Tableau, you can get 50% off a quarterly membership. You just go to nextleveltableau.com and go down to the quarterly membership. You get tons of great content, 3 live training classes a week. You have office hours every week, a private Slack community, access to all the workshops I run for free, about 130 videos in a video library, and so on and so forth. So lots and lots of great stuff for you there. So again, the code is NETUG. You can see it at the bottom there, and it does expire on Friday at midnight. So if you are interested in joining Next Level Tableau or giving it a try for a quarter, this is a great way for you to do that. And we could maybe send this out in the notes for people as well.
Thank you. That's very generous, Andy. I'm a NLT subscriber, if that's what you want to call it. Yeah, it's really cool. I enjoy being part of Next Level Tableau. So
good.
I would advocate for that. You can find Andy on LinkedIn. That's where he's most vocal, I would say. He's not on Twitter anymore. Wow. I don't know what's the. That's where you talk. Active. There we go. That's better. That's where you're most active.
Nice. Okay, so Charlotte, I'll clean this workbook up and get it sent over to you to send out to everybody, and I'll also put the presentation in a PDF for you to send to everybody as well.
Thank you so much. Everybody, please show your appreciation for Andy.
Thank you very much, Andy. That was brilliant.
Yeah,
really appreciate
thank you. Sorry I got to run, but I've got another user group I need to go to. So I will chat with you all later. Have a good rest of your day.
Thank you.
Okay, bye.
Yes. And I'd just like to add, if anybody actually leaves the healthcare tug to go to the Northeast tug, you will not get a 50% discount, okay?
You can go to the Northeast tug because it's on straight after hours, so you won't miss anything. Okay, let me get this going again so that I can introduce Eli Holder. Is our next speaker. Eli is the founder of 3IAP. 3 is a pattern. His research and writing focus is on the intersection of social psychology and visualization design, looking at ways that data can both reflect and influence people's attitudes, beliefs, emotions, and behaviors. His research on equitable data visualization was the first to empirically show how conventional visualizations of social inequality can reinforce harmful stereotypes. And he's here to talk to us about stereotyping and bias in healthcare data. I will stop sharing. And how do I stop sharing? Did I ever start sharing?
No.
No, I didn't, did I?
I'm going to need 2 seconds. I'm trying to set up the permissions. Sorry.
So Eli is joining us from America. It is about 9-ish in the morning. Is that right? Okay, it looks like we've lost him for just a second whilst he's setting that up. So, anybody learned some cool things with Andy there? I learned a couple of cool new tricks. Anybody else pick anything up that they thought was cool that they're going to start using?
I personally like the variety, and I do think it's great to have the choice of all those different ways to visualize your key performance indicators, because you do need different ones for different models as well. And just watching somebody copy paste and adapt, copy paste and adapt, I think is a great way to realize how quickly you can actually get to different varieties as well to showcase with your stakeholders.
Eli is back now.
And Tom's learned that he's not the only one that struggles with the ZM function as well.
Hi, yes, we can see your slides, Eli, but you're muted.
All right. We see slides and only slides, right?
Yep, I can see them and I can hear you.
All right. All good. All good. Okay, let's get started then. So I'm Eli Holder. This is me. I'm a data designer, and my firm is 3 as a Pattern, where I help clients to design and develop data visualizations that play nicely with humans. Incidentally, this can be a little bit tricky, especially for visualizing social outcomes. So I also do a fair amount of design research. We actually have a new paper coming out at Viz next week, and it's called Must Be a Tuesday. And we look at more equitable ways to visualize population health disparities. And I'm excited to preview some of our results today. And so I've been looking at this for a little while now, and I think that there are maybe 14 considerations for humanistic population health visualizations. We only have about 30 minutes, and so if I had any self-discipline, I would choose one of these to really focus on, but I have not done that. And instead, we're just going to try to go through all of these in 30 minutes. And so for now, I'm calling this talk Deathly Data Viz, a morbid introduction to equitable epidemiology, or how popular population health charts can backfire and undermine public health, and what we can do instead. And so, of course, let's start at the Broad Street pump. I assume that since this is a meetup of British data viz nerds, we've all seen this chart by now. But this is Jon Snow's famous map, summarizing his heroic data collection efforts that allowed him to trace the cholera outbreak back to the infamous Broad Street pump, thus saving all of London with a single chart. And there's maybe more to the story, but in any case, it's an impressive feat for a chart. But on the other hand, this hot mess of a chart is more unsuspectingly heroic. It's 4 different photos of 4 different plots, each of which show that Americans are increasingly interested in exercise. And this chart did something that Jon Snow could never dream of, which is it actually motivated Americans to spend more time working out at the gym. So in a study of 64,000 members of a US fitness chain, people who saw this chart increased their weekly gym attendance by 24%, which is massive for a behavior like going to the gym. And so when people think of good data viz, they think of Jon Snow's maps, because good data viz is supposed to be intellectual and enlightening. It works by guiding us towards smarter, more rational decisions. And that's all fine. But there are other ways that data can influence us, and a surprising amount of it has to do with social psychology. For example, this chart on the right is influential, not because it supports more rational decision-making. It works because it highlights a social norm that people are sensitive to. And people who see the chart tend to match their behavior to match the perceived social norm. And then this is another chart that's influential, but maybe not in the way that you might expect. So this shows heart disease mortality split by racial groups for youngish adults in the United States. And charts like this are intended to communicate health risks to specific groups, to motivate protective behavior, to create accountability for policymakers. And this chart, by conventional design standards, is a pretty good chart. It's simple, it's clean. It disaggregates, it highlights contrast between groups. And these are all good things to aim for if this chart weren't about people, particularly people from marginalized communities. And so the problem with this chart, of course, is that it's deadly, arguably, maybe, at least indirectly. Or to be more precise, there are plausible pathways between the misbeliefs encouraged by charts like these and worse health outcomes for the populations being covered. And so to unpack this, we're going to look at how data can backfire even when it's accurate and well-intended. We'll look at how charts like these can reinforce misbeliefs about health disparities and health in general. And then we'll link some of these misbeliefs to actual health outcomes. And so the first half of this talk will be very depressing. But the good news is that we can do better. Not just better, provably better. So in part two, we'll talk about how design choices can impact people's beliefs about data, particularly when the data is about other people. And then we'll unpack my new study to show that we're not stuck with conventional bar charts. And that charts like this one on the left can be just as effective, but also better serve health equity goals. We are going to start in a dark place, though. So we'll get into some doom and gloom first, and we'll start with this question of what's the worst that can happen? Can information backfire? And so I'm going to share some examples of this, but I'd love to hear data disaster stories from you guys as well. So feel free to add any examples to chat, and depending on time, we can stop at the end and discuss what people have. Again, what are some examples of information that's accurate and well-intended, but that still ends up being kind of harmful in practice? So my first example is this chart. This chart shows the lifetime risk of lung cancer for 4 different groups of people based on whether they smoke and based on whether they're exposed to radon. The goal for this chart was to help people understand their risk exposure, their risk of radon exposure, particularly for non-smokers whose cancer risk jumps from 1% to 5% if they're exposed to radon. And this is a pretty big 5x increase for non-smokers. But what effect did this chart actually have? It seemed to convince non-smokers that they were immune to radon exposure. It had an invincibility effect. And that's because people understand health risk in relative terms, not absolute terms. So even though the 5% is a lot bigger than 1% for non-smokers, it's still relatively small compared to the 31% for smokers. So not only does this chart fail to increase risk perceptions for non-smokers, it actually backfires and reduces it. This one looks at information on health disparities in the US. All of this is going to be very US focused, I apologize, but we can talk about how it translates towards the end. But there's a common belief that raising awareness of health disparities will somehow help resolve them. But when researchers showed messages like these to white Americans during COVID, they found that it didn't just reduce support for solving health disparities, it made people less supportive of COVID interventions altogether. And so again, this is accurate, well-intended information, but instead of increasing public support, it actually backfires. And here's when we're looking at behavior. It turns out that showing people UV photos of their own sun damage is actually an effective way to get people to start wearing sunscreen. And this actually works. This doesn't backfire. But if you let people compare themselves to other people with more sun damage, it actually kind of nullifies this motivating effect. And so in a rational world, this extra context on other people shouldn't impact how you view your own information. But it turns out that looking down on other people with worse outcomes can make us feel content, and that can be demotivating. And so in this case, adding information cancels out an otherwise effective behavioral intervention. And so that's 3 different examples where good information goes bad. It can distort risk perceptions, it can undermine public support, and it can demotivate behavioral interventions. Which brings us to our first big takeaway, which is that information can easily backfire, even if it's accurate and well-intended. And this is probably the most important message that I can share. Ideally, I'd like to make all of you just a little bit more anxious about putting new information out in the world, especially if you're not sure how it might be interpreted, and especially if it's about people. Because information can backfire in ways that are hard to predict. And if folks have examples of data backfire that you've seen, feel free to keep adding them to the chat, and we can talk about it towards the end. So that brings us to our first section, looking at some of these charts. So this is pointing the finger. Who do we blame for health disparities when we look at charts like these? So in this next section, we'll look at how social psychology influences the way that we read charts about people. And to understand the problem, let's look at this chart a little bit more closely. You can see that, for example, every year, 102 out of every 100,000 people from Group B will die from heart disease. But that rate is lower for other groups, much lower. But why is that? What causes these outcome differences? And feel free to add answers to the chat. What do you think causes the disparities? What do you think other people might think? But I'll jump into some of the results that we've seen. So a lot of people will explain these differences in terms of personal attributions about the people within the groups. For example, you might say the disparities exist because one group drinks or smokes too much, or they eat poorly, or you might blame genetic differences, which is a whole different can of worms. But in reality, these differences are probably more reflective of external factors like access to healthcare or healthy food, living in neighborhoods with lots of pollution, or too many convenience stores that sell cigarettes, or more broadly, structural racism. And again, these are US explanations, but I assume that there are analogs for the UK or anywhere where there's just an inequality. And so one of the issues with a chart like this is that since it asks people to kind of fixate on these between group differences, it kind of subtly encourages people to blame the outcome differences on the people being visualized, because people's identity groups are the most salient factor that we can see on the chart, the group A, B, C, and D. And this is one of the big concerns behind deficit thinking or deficit phrasing, which is fixating on between group differences when communicating inequitable social outcomes. And this is actually backed by a fair amount of social psychology. For example, the fundamental attribution error describes how people in cultures like the US or the UK tend to blame people for behaviors and outcomes, even when those behaviors and outcomes are largely outside of their control. And our baseline results actually confirm this bias very much applies to health disparities. So before people saw any of our charts in the study, we asked them why are the health outcomes like heart disease better or worse for some groups, and we made them choose on a spectrum between kind of blaming external factors like pollution or insurance access versus blaming people's behavior. And as you can see, the distribution leans pretty hard to the right. So just 23% agreed that the differences were driven by external factors, whereas a big majority, 77%, agreed that it was related to behavior or kind of had a more personal blame explanation. And of course, we also tested the same question after showing people the charts. And we found that when people saw bar charts, this bias became significantly worse. So the bar chart conditions shifted the whole distribution to the right by about 3 points, which ended up moving about 5% of participants over the line towards personal blame. And so the problem with these personal attributions is that when they're applied to an entire group of people, it means that you're essentially stereotyping them. If you believe that these outcome differences are caused by differences in personal characteristics, then you implicitly believe in a harmful stereotype that people with worse outcomes are somehow intrinsically worse people. And this increase in personal blame implies that charts like these can be misread as evidence for harmful stereotypes or other misbeliefs about health disparities. And so our next big takeaway then is that data viz can be just as socially toxic as any other medium. Charts showing differences in outcomes can be misread as evidence for personal differences between groups of people. Brings us to our next section, which is downstream detriments. So we've got a pathway now from a chart to misattributions or misbeliefs or stereotypes. And we probably all generally know that harmful stereotypes are harmful. But something I learned while doing some of this research is that there are a number of plausible pathways between the misbeliefs like these and actually kind of undermining health outcomes. And so we'll trace through one example. We're going to start with this chart on the left. We'll actually end up with increased cardiovascular mortality rates for both Black and white people in the United States. So one of the implications of stereotypes and misattributions is an exaggerated sense of the differences between groups. And so a viewer might come away from this chart thinking that group B people are somehow essentially different from other people, meaning that they're essentially different from the person viewing the chart. And so the more that you believe that group B people are fundamentally different, the more prone you are to a form of what's called modern racism or aversive racism, where people kind of morally and intellectually believe in things like racial equality, but report kind of feeling uncomfortable or cold towards people from other groups. And there's some nuance here, but aversive racism is pretty close to explicit racial bias, which we can then link to health outcomes. So in this study, Black people who live in US counties where there's more explicit racial bias tend to die from cardiovascular diseases at a higher rate. And where this gets interesting is that the same study also showed a similar association for white people. And so if you're a white person living in a county where other white people are racist, that's actually bad for your health too. And so these charts seem to encourage misbeliefs that aren't just bad for equity goals, they can potentially undermine health for the whole population. And you can follow similar pathways for things like infant health outcomes, showing that counties with more implicit racial bias have more babies born preterm or with low birth weight. And there are different pathways from stereotypes to reduce support for big social safety net programs like Medicaid. And then finally, to the extent that charts like these imply genetic differences between groups, which they do, these charts likely also reinforce ideas that race has some basis in biology, which it doesn't, as opposed to kind of being a social construct that we all made up to justify slavery. And so misbeliefs about biological race can reinforce downstream misbeliefs that have specific implications for how the medical system interacts with patients. For example, med students and residents who believe in a biological basis for race also tend to believe that Black people have thicker skin or higher pain thresholds. None of these are true. But this leads to Black patients being kind of regularly misdiagnosed or underdiagnosed when presenting with pain. And I'm obviously not a physician, but misdiagnosing pain, understanding this, that's good. And so that leads us to our next big takeaway, which is that if we're not careful, visualizing health disparities can undermine health. And this can happen through a number of different pathways, but conventional health disparity charts can create misbeliefs about health. And those misbeliefs are associated with worse health outcomes, reduced support, and even treatment differences. And so taking all this together, charts like these may actually backfire and undermine our health. So by now we know that good data viz can backfire generally. We know that charts like these support misbeliefs about health disparities, and we can link those misbeliefs to worse health outcomes. And so charts like these, to the extent that they're out there and lots of people are engaging with them, may very well make us less healthy. And so that's all super depressing, but for the good news, we can do better. And so in this next part, we'll talk through how design choices can impact people's beliefs about data. And then we'll unpack my new study to show that we're not stuck with bar charts. And this chart on the left is an example of how we might do this better. All right, so next section is design matters. And so let's take a look at how data design choices can make a difference in how we interpret data about other people. Before we talk about data viz, though, let's take a closer look at stereotypes. Stereotypes are misperceptions of dispersion or variability. For example, let's consider a stereotype that people in this purple group are especially high earners. Stereotypes assume that within a group, people are more similar than they really are, and that between groups, people are more different than they really are. So the stereotype implies a distribution like this one on the left, where not only do people in the purple group earn more, their earnings are very similar, and therefore all purple people seem to earn more than all other people. But in reality, even if average earnings for people in the purple group are higher than average earnings for everyone else, the distributions will still look something like this chart on the left. You can see that earnings are widely distributed within groups, and that between groups, there's a lot of overlap. And this will generally be true for many different kinds of social outcomes, especially when the groups are based on something as loosely defined as race. So the next question then is, could certain charts create similar misperceptions? And let's walk through another example, this time looking at earnings for 4 different groups. This distribution on the left is close to reality for income differences between something like racial groups in the United States. Again, you can see that there are a lot more differences within groups than there are between groups. And so if we take these distributions and plot them as a bar chart of average income for each group, we'd end up with a chart like this one in the middle. But when people see this bar chart, they may not imagine the distribution on the left. They probably imagine something more like this. Without any indication of variability, it's very easy for people to assume that it's just not there. And so again, just like with stereotypes, charts like these can create a false impression that people within groups are more similar than they really are, and that between groups, people are more different than they really are. On the other hand, if we show these same distributions as a jitter plot or any other type of chart that shows the range of outcomes within groups, it becomes very apparent that within groups, there's a lot of variation, and between groups, there's a lot of overlap. And this actually parallels real life, where the more exposure you have to people from other groups, the easier it is to see them as individuals and the harder it is to stereotype them. And so we've tested this in 4 different experiments now across a bunch of different contexts and now 2 different papers. And we've consistently found that the charts that hide variability increase stereotyping and misattribution relative to charts that emphasize variability. And so when we're visualizing social outcomes, one thing that we can do to minimize blame and stereotyping is to show variability. So these bar charts on the left, just like dot plots or confidence intervals, they emphasize between group differences and hide within group variability. And this leads viewers to harmful conclusions about the people being visualized. And so we want to do more of these charts. We want to do less of these charts on the left. On the other hand, charts like jitter plots or prediction intervals or ranges will show within group variability. And this makes it easy to see how much outcomes vary within groups and overlap between groups. And this makes it harder to misread charts as evidence for harmful stereotypes. And then a second important thing to understand about why we blame other people is because we're lazy. We prefer stories that are simple and easy, and it's easier to blame other people. And so when we see a chart like this, most of us will immediately jump to blame and think of something like purple people earn more because they must be harder workers. Because even if that's not true, it seems true because it's easier and it feels intuitive. However, for people who kind of overcome this bias, there's a second step where we kind of actively correct ourselves. And we consider more complex or external factors, but only after first considering the more simple explanation. And so according to these theories, attribution biases are kind of a failure to put in the effort to consider these external factors. And so as humans, that's very depressing, but as chart makers, this is great news because it's another easy fix with design. For example, we could relabel this chart to something like restaurant workers earn more in fancy restaurants. And so people often give more weight to what they read in the chart titles anyways, more so than the plots. And so we can use our titles and our labels to save our viewers some cognitive effort and make sure that external explanations are at least one of the factors that they consider when they're explaining these differences. We can at least make them kind of harder to miss. And so our next big takeaway is starting a more hopeful note, which is that design makes a difference. And this is good news because it means that as designers, we have some control over whether our charts are harmful or helpful. So with alternative design choices like showing outcome variability or more assertive labeling, we can offset some of the harmful side effects of these charts and maybe even start to correct some misbeliefs that people already have. And so I've implied that this chart is better a couple different times by now, but let's start to back this up. And so in this next section, we're going to look at our latest experiment exploring some of these ideas for health disparity charts. Before we get into the designs, though, let's start with some design goals. What do we mean by better? What are the impacts we hope to see from a chart like this, and how would we know that we found our unicorn? There's actually two parts to this. So the first, we could say that a chart is better if it reminds viewers that outcome disparities are more reflective of social determinants and not evidence of one group's genetic superiority or some groups being kind of more careful about their health than others. Or to say that a different way, when people see health disparities, we want them to blame systems and not people. The second criteria is the chart also needs to actually be useful to public health agencies or anyone else who publishes population health statistics. So the reason that these charts exist in the first place is for things like communicating risk, encouraging public support, and motivating healthier behavior. And so we need both of these for a complete unicorn. Because even if a chart has a positive impact on things like attributions or blame, you wouldn't be able to use it if it's somehow still distorts kind of risk perceptions, or public support, or kind of other these key outcomes. And so our basic hunch in the paper was that conventional bars may handle the basics, but the chart on the right is the complete unicorn because it's better for shifting blame towards social determinants and should also have kind of comparable influence on things like risk perception, policy support, and behavioral intent. But what makes this chart so special then? What made us confident that we could kind of meet our unicorn criteria? The big idea here is reminding viewers that health outcomes can depend more on where people live rather than who they are. It blames geography and not people. And so we're accomplishing this in two different ways. First, the title says very directly, health outcomes vary widely by geography. And this isn't a causal statement, but it's still fairly on the nose. And we also call out states with the two worst group outcomes. And this ties bad outcomes to places rather than just the people or their identity groups. And both of these are based on that theory that blame and attribution biases happen because thinking through big systemic issues is just cognitively more difficult. And so we're saving people some effort by just gently reminding them that there are other factors at play than identity groups. The second big difference, of course, is that instead of just showing average outcomes for each group as a bar, the jitter plot adds some extra context with dots representing outcomes for each US state. And like we said before, this makes it easy to see how much outcomes vary within groups and overlap between groups. And this makes it harder to misread charts as evidence for harmful stereotypes. And so that makes our hunch a little bit more specific. So conventional bars might handle the basics, but these geo-emphasis charts on the right are the complete unicorn because it highlights geographic differences and not people differences. It highlights how health disparities can depend more on the systems where people live rather than who they are. And so we tested a few different versions of these charts. We tested heart disease versus liver disease. We also tested whether the charts show racial groups or abstract letter groups to handle pre-existing bias. And importantly, we asked every question twice, once before people saw the charts and once after, so that we get a sense of kind of the direct impact on the chart at the level of an individual kind of viewer. And so these were the baseline results for the basic conventional goals like risk, behavior, and policy support. And this is how people answered before they saw any of the charts. So the gray bumps here are the conventional bars, the blue are geo-emphasis. And then this is how people were impacted by seeing the charts. These were the results after they saw the charts. And so the first important finding was that both of these charts were equally effective for raising risk awareness. encouraging behavioral intent, and promoting policy support. And this is good news because it means that the geo-emphasis chart is at least as effective as conventional bars, implying that they're at least as useful for these kind of key public health communication goals. And that supports our next big takeaway, which is we're not stuck with these bar charts. If alternative designs like the geo-emphasis chart can create the same impacts as conventional charts for these communication goals, that implies that it should be safe to actually adopt some of these new charts. And it means that we wouldn't have to sacrifice risk perception, public support, or behavioral intent. And then for attribution, we tested 4 different explanations for health disparities: environmental issues, insurance, health habits, genetics. And we basically just asked people if they agreed that these could explain the disparities in the charts. And we also had one question, the one at the end, that forced people to choose between external and personal kind of explanations to see which direction they would kind of lean in if they had to choose. And these last 2 measures were where the charts started to diverge. And these are genetic attributions and the forced choice question. And for both of these questions, the right of the scale corresponds roughly to more personal blame. And so right is bad and left is good, generally. And we found that bar charts shift responses towards personal and genetic attributions, and that's bad. The genetic attributions are a big deal because, like we said before, they're associated with downstream effects like biologizing race, which has its own downstream effects like misdiagnosing Black patients for pain. On the other hand, the geo-emphasis chart had no effect on genetic attributions, and it shifted responses towards external social determinants, which is good. And these effects were significant, both kind of relative between the chart types, but also relative to people's initial starting beliefs. And this implies that bar charts aren't just relatively worse, they're actively harmful. And the geo-emphasis charts aren't just relatively better, they might actually have a corrective effect. And so overall, we've confirmed our hunches. Conventional bars can handle the basics, but it's harmful otherwise. And so it's only kind of half the unicorn. And then the geo-emphasis charts can handle the basics while also shifting blame from people towards systems. It shifts blame from who people are to where people live. And so our last big takeaway then is equitable visualizations support healthier populations. Data design choices like assertive titles and showing variability can play an active role in correcting health misbeliefs and harmful stereotypes, or they can make them worse. And since we can tie these misbeliefs to health outcomes, it means that our design choices could very well impact the health of the people that we're visualizing. Or to say that another way, to save lives, we should stop these bar charts. We can plausibly say that it would be better for all of our health if we stopped visualizing group outcomes this way. The good news, of course, is that we can do better. Design choices like emphasizing geographic variability might actually be corrective because they shift blame away from the people being visualized towards the systems that they live in. And even better is that, as we show in our paper, you can feel confident in adopting these charts in your own kind of public-facing data viz, because we've shown that they're at least as effective for critical goals like risk awareness, managing public support, and encouraging health protective behaviors. And even better than that is this is just one possible way to make these charts fair and kind of more effective. And we're just getting started with this. And so if you'd like to learn more, learn some of the other ways, what we've covered today was meant as kind of a whirlwind introduction to mainly visualizing population health. Some topics we didn't cover is, can looking at data viz make you literally invincible? Why was Igna Semmelweis really betrayed? Are risk ratios a little bit evil or very evil? So if folks are interested in learning more or diving deeper, or if you think that these are important topics for your colleagues to learn about, please send me an email. I'm eli@3iap.com. More than happy to set up workshops, trainings, have conversations, things like that. Or if you have design challenges that you need more direct help with, or big data-heavy reports or presentations, happy to help there as well. Client projects are how I pay for this research. So my practice is 3 is a pattern where I help mission-oriented clients to research, design, and develop safe, effective, equitable data visualizations. And I'd also love to hear your stories. So I'm actively researching this and always excited to hear stories from the field. And so if you just want to chat about better ways to visualize population health or how to look at social determinants, I'd love to hear from you as well. Again, I'm Eli at 3iap.com. Feel free to reach out. And then I've got links and all kinds of things up here for you guys, including the citations and everything from the talk. So feel free to check that out as well.
Thank you, Eli. That was, well, I found it very interesting. I hope everyone else did too. So Eli can not join us for the after party, so if you've got any questions for him, I would get them in now. Eli, where on earth did you get a picture of a cut in half?
I spent an embarrassing amount of time trying to get Midjourney to generate that, and it did not work, and I had to actually do some Photoshop. It was
So if you enjoyed this presentation, Eli also did the keynote at Outlier Conference earlier this year, and that was very good, very humorous as well, and featured another animal. Is that a common thread of your?
It ends up, it's not on purpose, but yeah, it happens a
lot. Sarah asks, if we only have aggregate data and not personal data, how do you recommend showing the differences and overlaps between groups?
So this one comes up a little bit. I use jitter plots as an example for this because it's something I test. It's also a plot that I personally like. And jitter plot does imply individual level data, or in the charts that we looked at, it's aggregated up to kind of US states. But you actually don't need that either. You can do things like prediction intervals or range charts that just show from like the 5th percentile to the 95th percentile of what the distribution looks like. And so that's a way of getting kind of the full range of outcomes onto the chart so that you can see the kind of overlap between the different groups. And other ways of doing it are usually, almost always with these results, people report something like standard error or standard deviation. And you can work backwards from that into seeing what if you were to kind of like extend that out to like what would a realistic range look like. You can do that as well to just give people a sense of this is how wide the outcomes vary within these groups. And so there's definitely other ways of kind of getting to it. And one of the things that we're trying to show with this paper is that it actually doesn't need to be at an individual level, because when you aggregate up to states, or I'm not sure what the counties. So counties would be an equivalent. You can start to see the geographic variability, and that can it's still aggregated at a fairly high level, but it's enough to kind of show that spread of outcomes.
Cool. Thank you. She asks, is there a link to the paper?
Oh yeah, so let me just.
So while Eli finds out, is there any other questions from the chat? Steve, how did you find that?
I thought it was brilliant, and I put in the question in there, just getting people to wonder whether there's any visualizations they have created themselves to think about. They might want to revisit that. I think that's a really interesting point on the aggregation as well, Eli. I mean, we've got many different ways we can cut and slice and dice that. Geographically is one, of course, but we've also got the deprivation index that we have, which identifies certain areas as to what level of deprivation there are as well. But the more level of detail you can get in a continuous way, I imagine that's a good idea. But how do you deal with it when you want to cut and slice it in multiple ways? So geographically, but maybe some other factors as well.
I actually think that's one of the things that I want to start researching next is I think part of what makes the by the way, the link that I put in there has links to the papers. It has links to citations. It's got links to the Outlier keynote. So everything should be there. But so one of the things that I think works about this chart is that just by showing geographic variability, you're letting people know that there are other causes than just kind of like what immediately meets the eye. So with this chart, the only thing that this chart gives you a hint at like what could be causing this are the groups, right? And so just by reminding people that like geography could could make a difference, then when you start to explain it, you now have at least one other factor that's kind of floating around in your brain. And so I think that could adding other dimensions to it. So like not just geography, but maybe turning it into like a scatter plot where it's geography and then like income or the deprivation index is just adding other potentially causal factors into people's consideration set for when they explain these things. And just kind of making it easy for people to know that these other factors can influence it could be enough to offset a lot of these issues just in and of itself. And so I think more dimensionality, more context is always good. And so I generally would encourage that.
Cool. Thank you.
Thank you. And Sarah's just posted the link for any colleagues that are interested in structural racism and health in the UK, the Institute of Health Equality link there to a report. So Eli, you might find that interesting to learn about the UK inequities. She says, although there are a lot of bar charts.
I mean, to be fair, like I didn't know this was an issue like 2 years ago before I started doing this research. It was surprising to me as well. A lot of these types of charts are how I would have done it prior to doing this research. So it's not a thing to feel guilty about, but it is a thing to maybe like start to correct when we have the chance.
Super. Well, thank you very much, Eli, for joining us. I'm sure everybody else joins me in a thank you because I can't talk to you, so I'll say it on everyone's behalf. Thank you very much. Do follow up with the link that Eli's put in the chat if you want the materials, and also check out his talks from Outlier and Chart Chat, which he's got linked on the same link there as well. Yep. Thank you, Eli.
Thank you so much for hosting. Really appreciate it.
Thank you for joining us all the way from the United States.
Brilliant. Thank you very much, Eli. Really appreciate that.
So our next on the agenda is a break. So please, we're 5 minutes late, so we'll give you another 5 minutes. So we'll come back at 3:05 for Steve's templates workshop to get on with a theograph or a teograph. How do we say it? I've heard people say it both ways. So maybe pop it in the chat if you've got a moment.
How can you pop that in the chat, Charlotte? I don't know. How do you pop a pronunciation in the chat?
Theo like the name, Teo like, I don't know. 15
Teo
minutes,
Walcott.
Helen. 15 minutes.
It's 15 minutes, yeah.
At 15:05. That's UK time. I know we've got a few people that are from the States here, but we will see you in 15. Hopefully you're all back. I've put a little poll in the chat about how we are pronouncing theograph or teograph.
Theo or Teo. I'm going to stick with Teo. I'm the only one voting for Teo, but that's because I heard somebody say it the very first time, and I can't get it out of my mind. It's a bit like when you first hear a song, you always prefer that first version, I think. So for me, it's a teograph. But this session isn't just about teographs. I'm using a teograph as an example of how I think you can improve productivity, but also consistency, and therefore the service that you're providing to the users of your dashboards. Darren's going to play catch up, so I better not be rude to him when he leaves, because he's going to watch it on record. But while I'm chatting and introducing the beginning, I would like to know in the chat, everybody that has heard of teographs before, can you put a thumbs up in there or a yes? And anybody who hasn't, be honest, put a no or a thumbs down. I just want to know roughly who has heard of them before I get to them later on. Okay, so you can see my screen. I'm going to continue.
A couple of yeses and a no so far. No, 2 no's, 2 yeses.
Okay, So that's good to know, because I will talk a little bit about them and introduce them. Okay. So in the context of what I normally do when I'm teaching people, I wanted to just very quickly run through where I see using templates fitting in. So fundamentally, what I always talk about is the fact that we want to build powerful dashboards, and I'll define that in a moment. But there's lots of different ways we can define a really good dashboard. I just like the simpleness of the fact that it's powerful. What makes it powerful, presumably, is because people are going to take action on it and make decisions, right? But there are other factors we include in there as well. What I found through talking with people, though, that there are typically a couple of few reasons why you can't build powerful dashboards. Design concerns. I don't think the quality is good. I don't know how to do something. There's so many things out there, information overload. And also, I'm kind of busy right now, and getting a dashboard out the door isn't the only thing on my plate at the moment. So I'm just too busy. So I try to address that through giving people the ability to have quality confidence, giving them the bits of learning that they need only, and also then thinking about how to turbocharge the whole of your build process anyway. We do that through various different steps, which I'm not going to talk about right now, because the one we're going to look at is the one on the last of this little animation, which is, of course, templates. So once we've actually agreed our scope, we're going to think about how can we shortcut to an end solution by bringing out templates. Once we've brought those templates in, we've got dashboards and charts working, then we can look at the next step, which is looking at best practice applied, making sure that that's all intuitive. So today I'm just going to look into templates. And in fact, there are different levels of templates, two of which we're not going to cover today either, but just to make sure you think about them yourselves. This slide's in here as well. So the first one would be calculations, right? There are calculation cheat sheets, and it was a really interesting conversation we had earlier on. Of course, I think Tom in the chat said, well, how do you apply those, Andy, to fiscal years? Or in your case, the NHS starting point is an April, not a January. So a lot of those calculations don't allow you to work on those calculated fields if you're just applying a fiscal year change, for example. So, for example, year -1 just doesn't work in that scenario. So you need a whole bunch of calculations, and you're going to be using them over and over again on different data sources. And so having a calculation cheat sheet kind of makes sense. Now, I've pointed at one as an example, and you'll get these slides, of course. One I refer to quite a lot is Luke Stanker's calculation cheat sheet, because other people's calculation cheat sheets are a great starting point, but of course you can build up your own library internally. Then, of course, there's templates for dashboards. So you want to have certain things that people are expecting to see, where they're going to look for the legends, where they're going to look for the navigation, where they're going to look for the filters, parameters, etc., etc. You want to have a consistent layout. You probably need various different formats. Not every organization bothers with that, but you might think about the Z flow, for example. You may fill up like some formats need a big chart with some bands at the top, some big ass numbers at the top, like Andy was making earlier on for the KPI cards, for example. So you may want different layouts, but there are different factors to consider there in terms of the flow of your users, the form and the functionality, but as well as any branding that you want to bring in there. But from my perspective, I'm really keen to try and provide a standardized approach to the end user, so that if they get a dashboard from different departments, they instantly recognize what they can do and where they can do it. So a consistent use, a consistent layout, consistent color approach, of course, really helps them feel familiar with a brand new dashboard, and they can get to use it much more quickly as well. So that's a really important aspect. So that's another approach in terms of using templates. But today what we're going to talk about is charts primarily, as opposed to tables. So in the pyramid of the work we do, the bottom of that pyramid really starts off doing things like building up statistics based upon the numbers we're wanting to analyze, based upon the questions we're trying to answer. We need to build up standard statistics, and then we get to the top of our pyramid, and that's when we're actually starting to analyze the information, to build insights and present the information in a way that people can take action. The problem we find, though, is that we spend too much of our time in the bottom half of that pyramid building the stuff, and not enough time actually analyzing the information and portraying that. So what we're trying to do with something like templates and in charts is to reduce the amount of time we spend building and increase the amount of time we spend analyzing and adding value. Okay. So some of the key points to think about is just user beware. Keep it simple, right? There are loads and loads of charts out there. and you can go overboard and produce something which is kind of meaningless to your end user or confusing to your end user. So you still want to make sure you're keeping things simple and that it's actually adding to the message and the story that you're trying to tell. Keep it about the insights and not the sexiness of the chart. That's a fairly obvious one as well. And I was really interested in Eli's approach around the bar charts being a bit of a problem, and how there's a light touch approach to really still show what people are expecting to see, and also a few more deeper levels of insight in there as well. So that was really interesting, because that's keeping it about the insights, but it's also keeping it simple as well. And when you're going to use chart templates, typically the data mapping process is the key. And that's what I want to focus in on in today's demonstration, is just walk through how I use templates and the steps I go through to make sure that I'm getting there as quickly as possible, and I've got the confidence that I'm doing the right thing and getting the right result. Bear with me. There we go. So data mapping is key. And in today's presentation, I'm going to use 3 different references. Again, the links, Charlotte might pop in the chat as well, but they will be in the presentation, but also at the end. But just to give you a heads up, I'm going to be using Workout Wednesdays as one of my starting points. I think it's a fantastic community initiative that people can get into. You could, for example, learn a lot by doing Workout Wednesday, or you could do what I'm going to do today, which is cheat, right? So stealing like an artist is about giving credit where credit's due. I'm going to cheat by taking a solution which was created by Donna Coles in one of the Workout Wednesday assignments this year. I think it was week 7. Yes, week 7, as you can see, called Toggle Selections. And it's a really nice, neat little user interface to allow your user to visually toggle between different selections based upon the data, rather than a drop-down filter box, for example. I'm also going to give you a reference to 2 different blog posts. One was written originally by Chris Dixon about what is a teargraph and how to build one in Tableau. And I've kind of referred to that as the original. So that's another blog which Charlotte's just put in the chat for you. That was originally posted on the Imperial College Healthcare Partners website. And there's also another how-to guide, which is quite useful for us, which is on teargraphs, and that's on the Healthcare Economics Unit website as well. So there's 2 additional resources. Why don't I just get off presentation mode right now and actually just briefly show you those as well. So here's the guide, which was written by Chris. It's a simple teargraph to get you in the mood, and talks to you about the data and the structure of that data, and then it shows a very simple approach to building a teargraph, which I'm going to talk about a bit more in a moment. And then he goes into a more advanced teargraph, which is what I'm going to use for today's walkthrough, which actually requires 2 data sources, which we're going to combine. These are very simple data sources, and they've just focused on some key headings. We've got the setting, we've got the event, and we've got the type of the event, and then obviously the date. So you can see with the dates, this is quite an old blog, but it's still relevant, right? The type is because a lot of the events start and happen at the same time, pretty much, like an assessment, for example. We're not so worried about the login and the log out time of an assessment. We are typically worried about or concerned about A&E visits, arrive and departure, for example. But we also have service start and service ends. So some events have a start time and an end time, and we want to know that pathway and how long people were in those particular events. And other times we just want to see the different types of events and where they're happening. And then we have another data source, which is an aggregation of that to show the same events happening. What was the initial date, and then what was the duration? So there's some bit of preparation that can go ahead, but it's quite easy to do. And so what I'm going to show you in a moment is a teargraph based upon this very simple data set. And then I'm going to show you another data set example, and it's only demo data, which has got lots more information in it that you might want to include in your analysis, and how you can easily do that when you're applying it to a template. So those are the steps you go through, and we're going to end up with something that looks a little bit like that one at the bottom, but I'll show you in Tableau in a moment instead. And then, as I mentioned, we've got the teargraphs, a how-to guide from the Health Economics Unit. This is quite cool. What are teargraphs, the use, the preparation of the data, various different software options you've got, etc., etc. It's not an in-depth guide. Watching this video and how to steal like an artist would be a quicker way to get through to the end result for anybody using Tableau. No worries, Sarah. Thanks for letting us know. And in the chat, very quickly, who's aware of Workout Wednesday, or rather, who's not aware of Workout Wednesday? If you're not aware, just say me in the chat. Not aware. Okay, well, so Jessica, it's a great resource. The website itself, would you believe, if you Googled Workout Wednesday, you'll find immediately. Lo and behold, actually, it's not just Tableau anymore. There are some horrible things about Power BI. The focus on Workout Wednesday is, here's something very specific. Go and recreate it. So it's kind of like the opposite to me for Makeover Monday, where Makeover Monday gives you something which is a nice data set, horrible visualization, go and improve it. Workout Wednesday is, this is a good visualization. It's a good data product. It's something really useful. How do you actually create it? And those challenges typically range from beginner style up to quite advanced style. And they release one every single week. The good thing is people like Donna Coles, who is actually one of the contributors to the project, also writes a weekly solution guide. So if you can't work it out, you can read her blog post to work it out, and then you start slapping your forehead and thinking, why didn't I think of it that way? Okay, so it's a great learning tool in that regard. And I'd strongly recommend, if you haven't, to have a look at some of the challenges there. There's a hashtag, obviously, there always is, hashtag Workout Wednesday 2024. You go into Tableau Public, you're going to find other people's solutions where they publish them up there. But you can also go to Google to find people like Donna's solution guides as well. I'm going to take one which was written earlier this year, which here it is originally from Donna. And I kind of like this as a usability. It's a very simple view. This is obviously not NHS data yet, but it will be. Where we've got states on the top, on the left-hand side, and on the right-hand side. These are the top 5 states, I believe. And on the right-hand side, we're looking at the same top 5 states. And just looking at a running total of, I think it's sales, going across our data set to see what's going on. We might, for whatever reason, not want to show Pennsylvania, so I can deselect Pennsylvania, and I still get to see it in the bar chart on the left-hand side. It's de-emphasized because we've taken the color away from it, but we can still see the bar, and it's been taken off my line chart. And likewise, I could remove Washington and Texas, and we get to see exactly the same impact. They're removed from the line chart on the right-hand side, and we're now just focusing in on the 2 that we want to look at, which in this case is California and New York. I thought that was quite a good thing to introduce us into our Teo chart. So let's have a look now at what is a Teo chart. Graph in a bit more detail. It's about patient pathways. What we're looking at here at the moment is just very dummy data, of course, is we've got 2 patients ID 1 and patient ID 2, and they've had multiple things going on in their pathway. And we want to visualize when those things happened and what sort of service was being provided. So we can see we've got the setting is being identified in this case, we've got the event itself, and then we can see these standalone events like the outpatient visit on the 31st of January lasted 0 days because it was just an in and out in one day. Whereas in this particular case, we had an acute visit, an inpatient admission on the 10th of May, which lasted for 50 days. So we can see all the different events for a particular patient. And that helps us visualize the service that they're receiving, but also potentially identifying any particular issues or that we need to address. So Teo graphs are a great way to visualize one patient's view across all the different services they get. And obviously, the more services you can bring into your data set, the more real this will be. So in the land of ICS and ICB, that makes it really useful for us to bring in data from multiple different sources wherever we possibly can. And that allows us to do things at a tactical level in terms of looking at a particular patient or identifying specific patients to see what's going on with them. But it also allows us to look at our data at a more strategic level to see if there are opportunities for improving service across those different services as well. So the use cases are quite wide, which is why it's useful to have a look at that white paper. Okay, so that is a Teo graph. And I'm going to use this as my template. Okay, so what I've actually got is another Tableau workbook, which has got this is dummy, of course, and it's very simple dummy data, but it's a different data set. Okay, so let's just look up here. I've got something called event and length of stay data. AC, the state AC is my acronym for actual. Let's just have a very quick look. It's a simple data set. It's a relationship between two different tables, one of which was one I showed you earlier on, where we've got the event data, and then we've got the smaller table, which is our duration data. So we want to effectively blend those and bring in the duration when it's relevant, but show all of the event data even when we don't have any duration data, which is why we got a nice, easy relationship set up. And if I click on there, you'll see that we are relating this based upon 4 key fields in our data set. We've got the NHS patient number, we've got the setting name and the POD summary and the event date. You could, of course, use a spell ID perhaps instead. So a combination of spell ID and patient ID would easily be all you'd need in terms of being able to relate these two as well. So it depends on what your data structure is as to how you might want to relate those. So that's our actual data that we want to then apply the template to. I've only got that one data source here, and I've only got one simple chart at the moment. So what I'm going to do is I'm going to go over to my template, and here it is. The template is the Teo graph, as well as my events split down by outpatients now, and the events over time, and my little selector here, which allows me to remove the ones I'm not so interested in, for example. And you'll notice what we're doing is we're removing them from the Teo graph, as well as looking at the events over time. And we have filtered down my patients. This is demo data still, so they've got exactly the same data in there, in fact, as patient 1 and patient 2. So we can see that there is 36 events for both of my 2 patients. But this just allows me to then build the functionality in my template so I can then apply it to my own data. If I click on patient 1, we are now filtering our Teo graph just to that one patient, and we can see the pathway of all the events that have happened for that patient. And at this point, it may be interesting for me to then add back in these particular event types, because it depends on how you want to navigate through the data as to how you're going to end up at that Teo graph. Okay. So before I go on, is there any questions about the Teo graph and why we're using that as an example today? Put that in the chat. I can see the chat. Luckily, I've got 2 screens, so I can see the chat below as well. So if you want to interact with me, Charlotte can interrupt me at any time she wants to ask me a clarifying question, but she can also jump on board if you've got any questions in the chat as well. So what I'm going to do is I'm just going to copy this dashboard by right-clicking on my dashboard tab, and I'm going to paste it into my actual data. So let's go over to my other workbook and paste that right now. Now, what happens is the data set that we created all of those charts, as well as all the charts on the dashboard, get brought through to my other dashboard. So you'll see I've got my very simple bar chart originally was in here, the pod count, and then the whole of the dashboard and all of the items which are in that dashboard have been brought over together with, have I got this on here? No, I've got it. Yeah, there it is. You can see up here, I've got 2 data sources now. So one is my template one, which is the event data plus, and the other one is my supposed real data, which in itself is mock data, of course. And what I want to do is just replace that data source with the one that's got my real patient data in it. And we're going to get lots of errors along the way, which is good because we're going to fix all that. And we're going to show you the order of events, because it's quite important to get the order of events right when we're fixing all those errors, to minimize the amount of time it takes us to utilize a chart template in this way. So the first thing I do is right click on here, and I get to replace the data source. If I click on there, you can see now that I've got the ability to just choose any other data source in my workbook. I've only got 2, so there's no choice to make here. And I'm going to select my real data. Before I do that, also notice we've got this option now, which replaces the current worksheet only. So that's really quite cool when you're wanting to test something, or when you're wanting to actually bring in the same template multiple times. It may be that you want to actually only apply it to one particular worksheet, for example. In this case, to apply to everything, so I'm click on OK. And yes, we get loads of errors. And this is where the fun starts, okay? So this is where we want to fix things. Now, I suggest a particular order of events, and I've already forgotten one of them, so I'm just going to undo. Now, I could pretend like Andy Creeper that I did that on purpose, but I didn't do that on purpose. So I'm going to go all the way back again, okay? So what I should have done at this point, bearing in mind this is my template, is I should have, depending on where I'm getting that template from, it could be that there's loads and loads of fields in here which actually aren't being used in any of the charts that I want to copy. And it's quite confusing because this is a very simple data set, of course, but quite often, of course, you've got tens and tens and tens of different columns and fields, and you're not really sure which ones you need to fix and address. So what I would do to start with is just hide all the unused fields right from the beginning. Okay, and then I would make sure that I'm not showing those unused fields. So now I know the scale of my problem. Okay, so I'm going to go back here. I'm going to copy this dashboard. I'm going to go back in to here, and I'm going to paste it. Obviously, I'm still going to get the errors, but they're going to be focused in on the ones that we need to address. So now I'm going to replace this data source, which is what I did just now, replace the data source, and click on OK. And what happens is a couple of things. Typically, if you haven't done this before, you'll see that we have some red exclamation marks appear on the left-hand side. That's telling us we've got a problem with a field. The problem is one of two issues. Firstly, it could be that the field doesn't exist in the data set that we've just swapped in. So it's looking for something which doesn't exist. The secondary type of problem is that there's a calculated field which no longer works because of the replacement we've just made. Okay, so you've got two different types. And as Andy said, you can click on the filter up here and just filter to calculated fields. Unfortunately, I'd like to do that the other way around because I'd like to show the non-calculated fields first, because in my approach, what I would recommend you do is to fix the problems on the source data fields first, and then look to see if there's any problems left on the calculated fields. Because quite often, just fixing the problems on your data source fields fix all of the calculated fields anyway. Okay, and I would always fix the measures first. So what do I mean by fix? Let's look at this chart here. We can see we've got red pills in the worksheet because they're being referencing to something in the data pane which has got a red thing on it. So let's look at a measure which is not a calculated field. Here's one, event data count. Why is that a problem? Well, because the original template had a field in it called event data count, but we don't in our new data set. We actually have something which is called event data AC. So it's got the same functionality, but it's just got a different name. So what we want to do in this case is just right click on event data and replace references to. So this is now happening at one field in the data source, as opposed to the whole data source, which is what we did earlier on. So I'm going to click on replace references, and I'm just going to type in event and find there's my event data AC, which is my new data source field name. Click on OK. And now this pill has gone green up here because it now knows what it can reference. There's still loads of errors that we need to fix. Let's fix another measure. There's one called duration. There's no field in my database called duration, and you can see that when I hover over, the error message says exactly what the problem is. I know that in my source data, I don't call it duration, I call it LOS, length of stay. So I want to replace duration, right click, replace references to, and I'm just going to type in LOS so I can find it quicker and replace it with LOS. And you'll notice now that that field with an error against it has also disappeared because it was actually a source field in the original template data source, and it's no longer being referenced anywhere, so I can remove it, or Tableau removes it automatically, in fact. So let's look at the other ones we've got here. So this one here is an action. I'm not worried about actions. They appear in the data source pane over here. But here is a dimension. So let me just double check that we haven't got any measures left. We haven't got any measures, so I can just see they're all blue pills now. And the reason why I do measures first is because it saves me a lot of time. And I had a lot of pain by not doing measures first. You can see here, for example, this pill, if I stop hovering on it, has got an icon in there, which is a sort icon. And that's probably being sorted on a measure. Okay, so if I were to replace the event dimension before I replace the measure that it's sorted on, it won't be able to reapply that sort anymore. And what it will do is give me an error message, and it will say event is being sorted on field ABC, which doesn't exist. We're going to remove the sort. And that would require you then to manually note down all the sorts you've made and reapply them when you've got the correct measure in your data source. And it gets even more tricky when you've got those fields in the filter shelf. So if you're referring to measures which haven't yet been replaced in the filter shelf, it'll actually remove the whole filter because it can't apply it. So strongly recommend you replace all the measures first. We've seemed to have done that. So I'm now going to attack from the bottom up all the other ones. This is in italics. So that means it's a system generated field. So I can't replace that with anything at this point. It's being used somewhere else, and we'll see that in a moment. So I just go back up, forget about the italic ones completely. Then I'm going to go to type. Now, in my new data set, type should really be a field called event type. So each column had its own specific name based upon where it's come from, and it's going to be called event type. No, it's going to be called event type. I do apologize. Click on OK. Setting, I'm going to replace that with a field called setting name. And I'm going to replace patient ID with sudo NHS patient number. Oh, that's typical. Things always go wrong when you're doing a demo. Did this loads of times earlier on. Event, replace that reference with POD summary. Click OK. And you can see very quickly a lot of those red exclamation marks are disappearing because calculated fields which are referencing them have now been fixed as well. So it seems that we've got a date field here. So I can right click on here and I'm going to replace my references to date with, I think it's called event date. There it is, event date. So this chart now is actually working perfectly already. We can see this. We've got the outpatient bar chart being color coded fine. We've got the labels working. So let's move on to the next worksheet. In this case, we had a tick box to say that things have been selected or a cross to say that they were excluded. The shapes are one thing that don't carry through when I replace a field which is being with another one. So what you can see here now on our shape marks card, we've got a field which is driving that, which was being driven by another calculated field previously. So I have to go back into shapes and reassign those shapes, which is a bit of a pain, but there's only two that we need to do. We've got false here. I'm going to go through, and because this is actually reverse logic, false is a tick mark, and I'm going to click on tick mark for false, and I'm going to click on OK. So all of those circles now become ticks. Let's go back to the dashboard, and we can see that I can only see false or true at one moment in time. So I'm going to have to tick one of these, and that will then show up in my event selector the other option here, which is the false one. So let's go back into shape and click on true here, and I'm going to apply that to being a cross because it's the reverse logic. Click on OK, and we can see now that this is the dashboard is starting to work quite nicely. Just a very quick aside, one of the reasons why I really liked using Donna Cole's data product here is because we've effectively got multi-select happening here on a parameter action. And there's a very cool and nifty trick that she's used, which is quite complicated, and most of us wouldn't sort it all out first time round ourselves. So we're able to use Donna Cole's intellect and bring it into our data product without having to really work from scratch on that one, which is another reason why the Workout Wednesdays can be quite good. Even if you don't have time to do it yourself, you can look at the data product they produce, then always being produced on very simple data sources, which allows you to then copy paste that functionality quite nicely. So let's get back and continue chronologically through from left to right on each of the worksheets. Here is a chart which isn't working at all, and we can see that there's a red pill up here. So let's double click into that pill, and we can see that it's got something called event data, and it's referencing to an undefined field, which used to be called event data in the template. If I look over here, we can see that we've actually got a field which is called event data. Where is it? Event data from AC. This might be where it goes horribly wrong because of that error message we had earlier on. So what I want to do is drag that beast into there, and it's not going to let me. Oh, there you go, fixed. So what we needed to do was just replace within the ad hoc calculation on the worksheet itself with something that was working. It was an ad hoc calculation, it was a table calculation which hadn't been saved into the data pane. So we needed to fix that actually in line on the worksheet as well. There's no problem there. So look at our tailograph. Very similar issue here. All the shapes haven't come through. They've come through back to the default. So I'm just going to very quickly go through to my shape marks card here. Click on shapes. I'm not going to spend the time applying all the right fields. So I'm going to click on the field versions. I'm going to assign that palette. We can see them over here. And now I'm just going to look at the visualization and say, well, I actually want a diamond at the beginning and end of each of my pathways. So my admission should be a diamond. My discharge should also be a diamond. My service end and my service start should also be a diamond. And just to make a difference, my GP visit happens in a trifle. So I'm going to make that a much thinner and less dramatic looking mark type. Click on OK. And our tailograph has now been completely populated with our own data. We've got lots and lots of patients in here. 10, but that's however many patients I put into my real data set. Obviously you'd normally have thousands, and at the moment there's no filtering going on. Then we have our patient bar as well. As I said, they're all dummy data, so my 10 patients have all got exactly the same type of information in there. We go back to our dashboard and everything's working nicely, so I can add my outpatients back in, so we bring that into the tailograph. We also bring it into our line chart. We can remove the smaller ones so that we can actually see the numbers being filtered here by the number of events each of these patients have got. That might then allow me to zone in on the patients that I'm interested in. Let's say we're going to take these 3 patients here. So my tailograph now is being filtered based upon the selection I'm making. So typically right now, your use case may well be that you've got certain questions that you're going to ask before you get down to the patients that you want to look at this level of detail. So therefore you might need to add a completely different front end data product prior to the tailograph itself. So I've just built this data product because it kind of makes sense to me with a small number of patients, but you might need to have more filters and more things going on, to visual filters, before you actually then even show the tailograph. So there are ways we can obviously do that if you want to hide the tailograph until you've selected the correct patients to show in there as well, because you can see I've got a lot of scroll bars here. You just click on that one, we just focused in. We're going to bring those back. So that is us taking a relatively complex chart type, in this case a tailograph, a relatively useful data product in terms of the way that we're actually filtering down and showing and visualizing and interacting, and we're applying it to our own data. And for me, as I said before, it's not just about the speed of deployment for you. It's also about the fact that that template chart is probably being used elsewhere in your organization, so that your users are familiar with exactly what's going on there as well, so that they can understand and get the insights more quickly out of what they've seen. Okay. Any questions in the chat?
No questions in the chat. Any questions for Steve, guys? We've got another few minutes with Steve. Well, they'll be here all the time in this portion.
Yes, and while we're here, then I'll just go back to my presentation. The other benefit, of course, of using somebody else's work, apart from speed and an application, is also that you can use them as a learning point as well in their own right. By looking at how other people have done things, you're going to learn something. So key takeaways from this is to remember that you shouldn't really be thinking about reinventing the wheel. A teargraph has been around for a long time. Somebody else in your organization may have a better one than the one I've shown you, but do try to reinvent and reuse something rather than rebuild it from scratch each time. Okay, because not only will you be fraught with errors and time, but also the consistency and the look and feel. Quite often it's the formatting, isn't it, that takes more time than actually building something, and you don't want to have to keep repeating those tasks each time. So hence having a well-formatted template really can be beneficial. I mentioned the 3 E's. No, I completely forgot. Don't forget the 3 E's. Let me just very quickly go back to what they are. Up here on the top right hand side, the 3 E's for any powerful dashboard has got to be, it's easy to understand for the end user. It's got to be easy for them to use. They need to know how they're going to interact with it and actually get something out from it. But it's also got to be easy for you to build if you're the dashboard developer or you're in charge of the dashboard developers. So those 3 E's are what really defines, in my opinion, what a powerful dashboard can be. And it's one of the reasons why templates are so powerful. Your actions are still like an artist, still the resources that I've referred to in this presentation. And then once you've brought things together into your dashboard, you're then looking to see how you can apply best visual practices to make sure that you're not misleading your users, very much along the lines of what Eli was looking at earlier on as well. You don't need to worry about that. Those are my contact details. But here's the resources that I referred to. One was Donna Cole's toggle selections. That is downloadable directly from Tableau Public. There's the blog on teargraphs from Chris Dixon. There's also the blog from Health Economics Unit on teargraphs as well, so you can get a better understanding of who and why people are using them. In general, I would suggest looking at the Workout Wednesday challenges, and there's the website for that. But lastly, don't forget the infinite inspiration from many, many people that are available in the data found themselves. Workout Wednesday is just one of many, many different challenges that you can get involved in. So do have a look at that as well. We will be publishing that workbook as well as the video on the Tableau user group site, together with the other 2 videos that we've done today, or the other 2 sessions we've had today. But if you really want to know when the template is available, because I'm going to be publishing it on Tableau Public soon, you can just email me at steve.visdaj.com and just note the Thug templates. So I'll put your name on the list and I'll make sure that you receive those as soon as they're available.
Super. Thank you, Steve.
Cool.
Any questions for Steve on theographs, teargraphs, on on taking somebody else's work and applying it for your own? Steve put a very good point on that very last slide. Always attribute to who you've stolen from. Don't just plagiarize, make it your own, and always give credit.
Absolutely, because we're always learning from multiple sources, aren't we? So it's hard to think about, but it's very, very beneficial for you to make sure that other people are learning from where you've learned things from as well.
Yeah.
Because there's always context.
Okay, well, if there's no questions for Steve, I'm going to start up our quiz. So throughout today's sessions, I have been noting down quiz questions and coming up with silly dupe answers so that we can have a little quiz. And the winner of the quiz will win some Tableau swag prizes. I didn't bring them in with me, but we've got a little mug. We've got some socks. Everybody loves socks. Got some pens, and I've got some stickers to give away. So can I just say, though, that I know we've got a few people from abroad on here. I can only send prizes to people in the UK, I'm afraid. So feel free to do the quiz, but if you win and you're outside the UK, I might have to give it to second place, I'm afraid. So I've put the link to Menti in the chat. So please hop on there. I'm just going to get my screen sharing. Can you see my Menti? Can you see that, Steve?
I'm just coming back to you. I was opening up Zoom. Yes, I can see. I can see the QR code. Yeah.
Yeah, you can see time 2 and there's a little party. Cool.
Yeah.
So yeah, please join there. Give me a little thumbs up or little hearts that you'll see at the bottom when you're in. There we go. Good. Some people joining. Doesn't tell me how many people have joined. This is my first time using it, so apologies if it does all go a bit wrong, but hopefully we'll get it all right. Hopefully it'll go right. So I am going to start the quiz. Oh, there's everybody. There's 11 of you ready. Awesome. Okay. Any more joining us? Got 11 of you. I know there's 23 on the call. Last chance. 5, 4, 3, 2, 1. And the first question is, what is a KPI? Is it kind of powerful information, key performance indicators, or keenly packaged improvements? Everyone's voted. Let's see what you said. Yeah, who said keenly packaged improvements?
That might have been me.
Well, everybody got it right. Well done, everybody else. So, who is winning? Hopefully you'll know who you are. Wolfmeister, you are in first place at the moment. Let's keep going. Question 2. Oh, we've got another player. 12 players. Oh, there we go. Okay, question 2 is, what was Andy's colour palette called? Was it Maggie on the couch, Sophie on the sofa, or Meg on the bed? Yeah, these aren't always going to be, very highbrow questions. A lot of them are just for fun. Let's see if you all remember.
But there's swag at the end of the day, right? That's what matters.
Swag. It is Maggie on the couch. So Maggie is Andy's dog.
I'm glad you clarified that.
Looks like Wolfmeister is still at the top. Okay, and on to our... Oh, we've done that one already. Where did we go? Andy's colour palette called. We've done that. Okay, question 3. How does Andy make sure the filter works before the level of detail calculation? He creates a parameter, he shows the filter, or he adds to context. Okie dokie. Ah, bit of a spread there. So yeah, he adds to context. And that just means that it will do, in the order of operations, it just means that it will do that. It kind of makes it do the filter before it does the level of detail calculation. Wolfmeister is still up there. Bill and Jessica, you've been second and third for a while.
I didn't even get a chance to enter my name. I don't know who.
What did Jon Snow help rid London of with good data visualization? Was it rats, winter, or cholera? Everyone's voted. Let's have a little look. Aha, rats. Who said winter? You got your Jon Snows mixed up. It was cholera. Is Wolfmeister still at the top? Oh, a little change at the top there. Wolfmeister still at the top, but second and third coming up. Question 5. Hiding variability increases perfectionism and beliefs, blame and stereotyping, or praise and original thinking. So this is from Eli's talk. Okay, let's see what you all said. Blame and stereotyping, that is correct. Are we now? Oh, the Wolfmeister's gone. Tom,
She dropped off, maybe.
you're in the lead. Question 6. What chart does Eli use to help eliminate personal stereotypes? Was it a bar chart, a jitter plot, or a pie chart? Okie dokie, let's see what everyone says. A jitter plot. Yes, no, a bar chart causes death. Death by bar chart.
And sometimes a pie chart does too, actually.
Okie dokes. And I think the next 2 questions are based on what Steve has done. Looks like Tom is still at the top. Barefoot Contessa and Beyonce coming up. Okay. Question 7. Oh. Question 7. Healthier populations are supported by equitable visualizations, fruit and veg at the chippy, or 2 pints of lager and a packet of crisps.
That wasn't for my presentation, I don't think.
No, it wasn't. Sorry. Yeah. Yeah, that was still an Eli question. Hopefully you've all got this right. Couple of jokers in the room, I see. Yes, the answer is equitable visualizations.
It's very close.
It is getting close, isn't it? Tom's still up there. Okay, in question 9, 8 even. Oh, sorry. There we go. Whose template did Steve steal like an artist? Was it Donna Summer, Donna Moss, or Donna Coles?
Tableau legend.
Donna Coles. Whoever said Donna Moss, I hope you know who she is. She's from one of my favourite TV shows. Donna from The West Wing. Donna Summer, obviously, disco queen of the 70s. It was neither of them. It was Donna Coles. Okay, let's see. Tom's still going strong at the top there. And the last question. Theo or Teo? Let's see. The people have decided Theograph.
Only just.
But you will get points. I marked both of them as correct. So let's see. Looks like Tom probably will be the winner. Yeah. Tom, you are the winner. Well done. You get some goodies sent to you. If you could just pop your email address in a direct message to me, then we can get going with... yeah, we can send you your stuff. Tom Moore, that is, who's won, I think. Let me just share my screen again. Well done, Tom. Yep, share that screen. Share. There we go. Right. Let me get back on. Not that one. So yeah, that brings us to the end of our main content for today. But I would like you to save the date, please, for Tuesday, the 10th of December, between 1 and 5 p.m. We've already got 2 excellent speakers lined up in Andy Cockgreave and Klaus Schulte. Please do come along to that. We're just just trying to get a venue sorted, and as soon as we've got the venue sorted, you'll get your invites out. So on the venue, we need your help. We need you, the Tableau user group, to help us. If you have space to host us, please scan this QR code on the left, and hopefully, yeah, we can come to a locale near you. And equally, if you want to speak at one of these tugs, if you've got some work that you want to show off, or if you've got some learning to impart, please apply to be a speaker. You've got the speaker QR code there. It'll take you to Google Forms to fill in. We really can't do these without you. So yeah, please get involved.
Can I just say, also happy to hear people who want input on what they're doing as well. So maybe they want some steering and guidance and thoughts on something which is a work in progress. That's something that people really enjoy getting involved in as well.
That just leads me to say thank you for attending today. We are going to go now into, if you want to join us, that is, you can come into our Zoom party. Where we can continue talking to you. We can talk about the presentations we've seen today. We can talk about future tugs. We can talk about whatever you like. So please scan this QR code, or we'll put the link in the chat also, and head over to the Zoom call. I'm going to stop sharing so I can come back and see everybody.
I'll put the link into the chat already. Yep.
So thank you, Lisa. Thank you, everybody, for saying thanks. Hope you really enjoyed it. Hope to see you in December, and indeed all of next year as well when we do them. So thank you, everybody. Please join us in the Zoom in a couple of minutes. We'll be there at 4 o'clock. But thank you, everybody, for joining us.
Thank you. Hope to see you in the after party. I'm already there, actually. There's nobody else joining me yet. Up on the big screen. Okay. Cheers, Jalesh. I'm
going to leave now, Steve.
Okay, I'll leave as well. I'll see you in there.